really 7 months have gone by since this pandemic, and I think the way we live, how we do things, has really changed dramatically. And I think that that is something that we has been really disruptive to everybody. It's not just the deaths and the sick people and the economy, but it's really the disruption in our daily lives that has many people, you know, we're depressed, we're anxious, we don't know what the future is. And I think one of the things that we have to do is to remind people that this thing is going to be over and that science is critical in getting us out of this problem. I'm just put this as an example of how science has been dramatically important. December 31st, we had the notification to WHO, China office of the cases of this disease. By January 7th, this virus had been identified and a sequence had been made. And only 60 days later, 65 days later, by March 16th, the first dose of a coronavirus vaccine was administered to a human. And by July 27th, a phase 3 study is already starting. Nowhere in the history of diseases has so rapidly we've gone from discovering a pathogen to having vaccine studies. And I think this is what really science does, and this is what science does at its best. We won't spend a lot of time in the virus, but I think it's really important to remember that this virus has come from animals, and animals to human zoonosis, a virus that go from animals to humans, will continue to be a problem going forward. And it's something that we need to remind ourselves that animal health and surveillance of animals is going to be very important in trying to understand these problems. The other thing is that the intermediate host of this infection has been thought to be the pangolin. And I mentioned the pangolin because I had never heard about the pangolin before this pandemic. But the pangolin is the most trafficked animal, illegally trafficked animal in the world. And again, it emphasizes the importance that illegal traffic of animals have in human health. This is one of 7 coronaviruses that impacts humans, and we know that that many of these coronaviruses cause common colds and don't cause a lot of disease. But SARS, MERS, COVID, and now COVID-19 are viruses that cause significant morbidity and mortality. So I'm not going to talk about the numbers that have already been mentioned. And I have a little bit of a chronology of the pandemic here that I've been putting together. And again, just emphasizes how the pandemic rapidly exploded, first in China, then in Asia, then in Europe, and now in the Americas. So we know about transmission, and I think that we know more and more the transmission really happens through both droplets and aerosols. It's really important to keep clean hands. I think we increasingly recognize that contamination of surfaces is not that important for transmission. But I think, frequent cleaning of hands, disinfection, physical distance, and the use of face covers is a critically important component in controlling transmission. I think one of the things that we've learned is that only about 10 to 20% of people are responsible for about 80% of infections. And I think, therefore, it's really important to find those individuals. And we also know that a lot of the infections occur transmission occurs about a day or two before the onset of symptoms. We know also that mortality significantly increases with age. And we also know that a lot of people, about 40% of people, are asymptomatic. And depending on which study you look at, this asymptomatic infection is actually a major issue because there's a lot of transmission happening. And this really is the Achilles heel of this infection because you don't know who has it and who doesn't. The clinical symptoms have been very interesting. And what I want to remind people is that a lot of the symptoms are not respiratory. And I particularly find very useful the anosmia and the dysgeusia as important symptoms. The loss of smell and taste are really important symptoms that are present in about 60% of people with this infection. I mean, I had a friend in Mexico text me yesterday saying, he was feeling fine, and then he woke up in the morning, couldn't smell anything, couldn't taste anything, and then he realized he had infection. Again, the risk factor for severe disease, we talked about age, but two very important in our region in the Americas are diabetes and obesity. And with the epidemics of diabetes and obesity we have in the US, that we have in Mexico, that we have in Latin America, the mortality from this disease is disproportionately high. So when we talk about pandemics, we talk about the three I's, information, identification, and isolation of cases. And therefore, finding who has this disease and isolating them becomes very important. And we got to remind ourselves that over 80% of people with this infection can stay home. They don't need to go to the hospital. Very few people actually need to be taken to the hospital. And it's really those that have shortness of breath, that have respiratory symptoms, that need supplemental oxygen, that need to go to the hospital. So we clearly need mitigation is a very important strategy. And mitigation is done through non-pharmacological measures. And among the non-pharmacological measures is obviously, many things, but testing is also a critical component. And testing can be both molecular tests or serological testing that can be done. I think one thing that is really important to remember in this pandemic is the significant impact on healthcare personnel. And depending who you look at, 20 to 40% of cases are among healthcare workers. So protecting our healthcare workers is a critical part of this pandemic. So let's talk about social distancing. Why social distancing is so important. In this virus, one person infects about 2.5 people over 5 days. And those 2.5 people infect about another 406 people over the next 30 days. If we can decrease exposures to that one individual by 50%, then at the end of 30 days, you only have 15 people infected. And if you can decrease exposures by 75%, then at the end of 30 days, you only have 2.5 people infected. So yes, a face mask is important, but social distancing is also very important. And we need to remind people that wearing a mask does not prevent practicing social distance. And there's very clear evidence from Italy and from San Francisco and studies published recently that social distancing makes a difference and actually decreases transmission. So I want to mention just a few things about therapy because, again, science has been very important here in therapy. And I want to emphasize that hydroxychloroquine and azithromycin do not work, and yet we continue to see prescriptions for these medications. The science shows us that these medications don't work, so we should not be using them. Very few things have shown effectiveness, but among the things that have shown effectiveness are remdesivir, our hyperimmune plasma, and our dexamethasone. Those are the three things that so far have shown effectiveness. And monoclonal antibodies are under investigation as well as other drugs. And I would recommend that you look at both the NIH and the IDSA treatment guidelines as a way to look at evidence-based, science-based treatment recommendation for patients. Vaccine research is also another area where research is shining, and I show you this, and how vaccines have gone from preclinical to phase 1 and now being in phase 3. But we have a lot of challenges ahead when we think about vaccines. And among the challenges are the production, the distribution, the way we're going to make sure that the most vulnerable populations actually get vaccinated. And this is going to be a logistical challenge for many countries. I want to emphasize that the United States, when they lifted restriction, we did not do well. And when we lifted the stay-at-home orders and opened the country very rapidly, cases went up. And I think this needs to be remembered because if you open inappropriately, you're going to have a problem. And in fact, the US has had multiple problems in the management of the epidemic. And this MMWR by Ann Schuchat from CDC shows some of the problems that really the US mishandled in the epidemic. But if we want to summarize what the problems in the US have been basically underestimation of the problem, it's not having a national strategy, very poor coordination among the states, and significant errors in the production of tests at the beginning that really delayed diagnostic testing for many, many weeks. But it was that opening early that was a major problem. And you can see the US loosened restrictions when we had 68 cases per million compared to Italy or other states that were way below. Even Canada, Canada was at 10 cases per million when they loosened restrictions. So the US simply did it too early. The response of the national academies of the United States has been multiple and has included rapid expert consultations, reports, webinars, and I would recommend you go to the National Academy of Medicine website where there's some excellent resources. Mexico has also been a country that hasn't had a very effective response and has had a president that has been a refusal, just like Trump, has refused to use face covers and has indeed said that, we need to hug each other, we need to kiss each other, nothing happens. And he has been in favor of religious representations to get over the epidemic, and has said that, this is not a big problem. This is not even as close to the flu. So a lot of misinformation happening from the president. And in fact, I put this as an example. The president said that this were the 10 things that the country needed to do to get out of the pandemic. And while some are very useful, like, keep yourself informed and follow the recommendations, there were some things that make absolutely no sense, like, don't be sexist, and reinforce the natural values, and just things that didn't make any sense. And again, the president of Mexico will not use a face cover until he had to get on a plane to come to the United States, and then he put a face cover. Mexico has had a significant problem of not protecting its healthcare workers, and 1 in 5 coronavirus cases in Mexico have been among healthcare workers. So I think protecting the healthcare workers is a national priority that we need to take seriously. I think there's also been a proliferation and touting of therapies that have no benefit whatsoever by leaders, whether it's Brazil, the US, or Mexico. The president of the US talking about hydroxychloroquine, or the president of Brazil, or the president of the US talking about Clorox. I mean, really very, very bad leadership. So I think, this pandemic has had enormous consequences for health and for the economy. I think the response of the scientific community has been really remarkable, but the lack of leadership has been a major problem that has led to bad management of the pandemic in many countries, including the US. But I do think this pandemic is going to end, but it's not going to be soon. It's going to take some time for this to end. Here are some recommendations that I put together about things that we need to do as countries. Number 1, we need to make sure that the healthcare workers have adequate personal protective equipment. We need to make mandatory and universal the use of face covers. We need our countries to be doing at least 30,000 tests per million population. We need to do effective contact tracing. We need to do serological surveys in big cities and among essential workers to find out the extent of the infection. We need to do careful monitoring of sewage waters to find the virus in urban areas. We need to be transparent on the epidemiological information. We need to make sure our countries have budgeted for vaccines and drugs for 2021. And most importantly, we need to take away from, we have made a mistake of politicizing the technical, and therefore what should be technical has become political. But we also need, as technical people, to make sure that we're educating politicians. And when we reopen a country, we need to make sure that we reopen, we need to reopen like you open a water faucet, and not like you turn on the light. This is not going from close to open, but this has to be a very slow opening of the economy so you don't run into problems like we did here in the US.